Good afternoon, everyone. Welcome to Yashoda Hospitals webinar series. Myself, Dr. Amar, AVP Yashoda Hospitals. I hope everyone is super excited for today's Nursing National Quiz. Today we are covering neonatal nursing with everyone's demand and on request. There is no need to introduce much about today's host. Everyone is familiar about her. Today's host is Ms. Pratusha, AGM Nursing. And I would like to talk about today's quiz. As everyone know, we conduct generally 4 rounds. There will be 3 questions in each round. It will be quick and rapid fire. These are all time bonded. So you need to be more proactive and read the questions immediately. Try to act on the answers fast. And these are like, time bonded within 30 seconds and depend on the question to question. And your time will be reflected on your monitors. And wish you all the best for today's quiz. Pratusha, please take us to live quiz.
Sure, sir. Thank you, Amar, sir. Vanakkam, good afternoon, and Sashri Akar for everyone, those who have joined for the Nursing Pro Quiz today. So, firstly, I wanted to tell about today's importance, like Happy Sri Ramanavami, everyone, those who are watching this quiz today. So from Yashoda Hospitals, we are organizing this neonatal nursing quiz. So before going to the quiz, let me read who have just joined. We have just got 1 minute to join again. So Jerry, Pushpa, Amravati, Jyoti, Manjula, Srilata, Shravya, Isha, Jennifer, Sneha, Nirmala. So many of you are still joining. So before this, I wanted to just make sure that you will get a brief introduction about what we are exactly going to discuss today. So let us start. So welcome to the Nursing Pro Quiz on neonatal nursing. So we are good to start now. Before this, I wanted to just explain you much about what is first round and what we are going to discuss in this one. So first round is about the essential newborn care. In this essential newborn care, first we will try to talk about 3 questions. In these 3 questions, make sure that you will answer all the 3 questions, and last, the 3rd question will definitely have the double points. Make sure the 3rd question is so prior. The key for it's a game changer actually to increase your score. Round 1 will be essential newborn care. Round 2 will have hemodynamic monitoring in neonates. Round 3 is about neonatal hypoglycemia. Round 4 is about neonatal resuscitation. So all the best to all of you who have joined this neonatal nursing pro quiz. So let us start without any delay. Before that, I wanted to give you a very key factor for this quiz. It's not about playing the game in the right way, but playing the game with the fastest finger first. Who plays the game with answers the question faster, those will be on the top score. So this will be so exciting. The first question is here. After the delivery, the nurse prepares to prevent heat loss in the newborn. Just give me a minute. So after the delivery, the nurse prepares to prevent heat loss in the newborn resulting from evaporation by. The options are option A, warming the crib pad. Option B, turning on the overhead radiant warmer. Option C, closing the doors to the room. Option D, drying the infant in a warm blanket. What would be your answer for this question? You have just got 15 seconds to answer this question. Read the question properly. After the delivery, the nurse prepares to prevent the heat loss. Who's a newborn? And which results in this from the evaporation? Which resulting from the evaporation by what? What of these options will be the right one? So we have got 86 answers from the participants, and the option D is the right answer. Drying the infant in a warm blanket is really, really important. Let me show you the scoreboard first. Who is on the top? Oh my God. So Arun Kumar Das is on the top. Manjula is on the 2nd. Nana G is on the 3rd. Team People and Tinokal is on the last 5. So this is the score. Let us see the rationale behind the first question. Drying the infant in a warm blanket is really important. The option is D. And the newborn temperature at the birth is around 37.2 degrees Celsius. because they have been confined in their mother's warm uterine environment. So the newborn's temperature will immediately drop upon delivery due to the various factors. So always pre-warmed cloths needs to be used, and it should be ready when we are trying to receive the baby. Let us go for the next question. Are you all excited? Yes, here's the second question. The question is asking about vitamin K is prescribed for a neonate, and a nurse prepares to administer the medication in which of the muscle site? Vitamin K is prescribed for a neonate. The nurse is trying to prepare that, and which muscle site do you prefer to provide this vitamin K? And the options are option A, deltoid, option B, triceps, option C, vastus lateralis, and option D is biceps. What do you think would be the best muscle site to provide this vitamin K injection? So let us see, so many people are answering this question. 83 answers we have received as of now, 85. The time is going very faster. Please make sure you will answer the questions. 87 answers, 88. We have more participants today for the quiz. So just 5 seconds more. Make sure you will answer the questions. 92 have answered, 93, and the time is up. So 75 people have answered it correctly. That is, answer is C, vastus lateralis. So are you all excited to show the scoreboards? So this is a scoreboard. Arun Kumar Das is again on the top. Nanaji is on the second top. Anu has again gained the third position. And Siri and Amu. These people are on the top. Let us see what is the rationale behind this question. Vastus lateralis is the site where we try to provide this vitamin K injection, which is a prophylaxis for hemorrhagic disease. It is also given in the intramuscularly in the vastus lateralis muscle. The vastus lateralis muscle lies lateral to the midline of the thigh and wraps about 1/4 of this. So this is where in the picture it is depicted where we are trying to exactly give the vitamin K injection. So let us go for the last question in this first round. So make sure the fastest fingers are again on the top, because this question will have double points and you have to swipe the options up and down. Swipe the options up and down because you need to arrange that in the order. The third question is about when performing a newborn assessment, the nurse should measure the vital signs in the following sequence. So here on the display, you can see pulse, respiration, and temperature. So you have to swipe it up and down so that you can arrange the answer in the sequence. You have to swipe the answer up and down on your screen so that we can see that whether it is a right sequence or wrong sequence. So the options you have got is pulse, respiration, and temperature. It's easy, just you need to arrange up and down. That's it. You have got 20 seconds to answer this question. I'm going to repeat the question for you. When you're trying to perform a nursing newborn assessment, the nurse needs to measure the vital signs. So in what sequence the nurse needs to measure it? You've got 5 seconds to answer. Almost 90 people have answered this question. We have just got, the time is up. Okay, only 26 people have rightly answered it and 78 people have wrongly answered. Okay, it has got the great respiration as the first sequence, pulse and temperature. This is a sequence always we maintain in the newborn when we are trying to assess the vital signs. So let us see the scoreboard. Oh my God, Arun Kumar have just gayab hua. So now Anu is on the top, Monisha is on the second, team people again on the third, Moniswamy and Jisha is on the fifth. So let us see, make sure that your scoreboard will definitely change because of the double points. So let us see this answer with the rationale. Answer is D, as respiration, pulse and temperature will have this sequence because this sequence is least distributing, where touching with a stethoscope and inserting the thermometer always increases the anxiety and elevates the temperature. That's why we always have the scope of first checking for the respirations, then for the pulse, and then for the skin color, as well as the muscle tone. So this sequence is mostly preferred rather than having the temperature at the first and then pulse at the second and respiration at the third. So let us go for the next round. There's the round 2. It's about the hemodynamic monitoring in the neonates. Make sure this will be a little tougher for you in case if you have not read about hemodynamic monitoring. So let us see the first question and make sure the timer will be less than the first round. Now the timer is only about 30 seconds. So make sure you will answer the right time. The question says that the total amount of blood that is ejected by the heart in 1 minute is known as cardiac cycle. That's a true or false question. You just need to opt either it is true or false. The total amount of blood that is ejected by the heart in 1 complete minute will be called as cardiac cycle. Do you agree with the statement that it is true or false? And you have just got 5 seconds to answer this question. Oh my God, almost we have got 108 answers, 110. Great. So 32 people have rightly answered, 78 people have wrongly answered this question. So the answer is false. So let me show you the scoreboard before going to the rational. Anu is on the top. Maunami is on the second. Jisha is third. Gayatri and Monisha. These are all on the top 5. So let us see. These will try to again climb their first ladder. The answer is false because the total amount of blood that is ejected in the heart is in 1 minute will be not as cardiac, will be called as cardiac output, not cardiac cycle. Next question in this one, this is like multi-select. You can select more than 2 options. Make sure you will select the 2 options. The question says, capillary refill time in neonates alone cannot determine the hemodynamic stability. So to do this one, it should be monitored along with 2 things or 3 things. So what would be your answers? You have to select at least 2 options or 3 options in this one. Select 2 options because it's a multi-mode. The options are option A, blood pressure. Option C is oxygen saturation. Option C is respiratory rate. Option D is level of consciousness. And the time is up. So let us see how many of you have answered it. Wow, great. So 30 people around this have selected blood pressure. B is only for 59 people. Let me see the scoreboard to understand whether how many people have rightly answered this. Okay, Anu is on the top again. Jisha is again on the second. Monisha and B is on the 4th and 5th. So let us see what is the answer. There's option A and option B are the answers because whenever we are trying to check this hemodynamic monitoring, we also need to consider not only capillary refill time, but also blood pressure and oxygen saturation. So CRT is nothing but capillary refill time alone cannot talk about this neonatal age. Is less informative hemodynamic parameter. That's why it should be evaluated along with either blood pressure or oxygen saturation with pulse oximeter. That's why the answer is A and B. So let us go for the next question, and this, make sure you will answer it rightly. And this is the last question, and you will have double points for this. Make sure you will definitely score. The question is talking about an umbilical venous catheterization was done for the newborn baby weighing 1000 grams to monitor the CVP. What is the normal CVP in this one? We're just asking about what is the normal CVP. So option A is 2.5 to 3.5 centimeters H2O, and option B 8 to 12 centimeters H2O. Option C 5 to 9 centimeters H2O. Option D is 5.5 to 8.5 centimeters of H2O. What would be the right answer? We are getting almost 106 answers. Great. So B is the right answer. Yes, 38 people have rightly answered this one. Who's on the top again? Oh, Anu again have scored the top score, and Jisha from SMJ have scored second. Gayatri and Jisha again onto the same top scorers. Congratulations. We're again going for the rational, and I'll get back with the 3rd round. So answer is B, that is 8 to 12 centimeters H2O. A normal CVP in a normal compliant heart of a newborn is typically 8 to 12 centimeters of H2O. And the higher pressures may always reflect the volume overload or poor right side heart compliance or functioning. So that's why the normal pressure is only 8 to 12 centimeters of H2O. So let us go back again for the 3rd round. You're ready for the 3rd round? Yes. So the 3rd round is again about the neonatal hypoglycemia. Again, I'm trying to remind you, fastest finger is on the top first. Make sure you will score good in this 3rd round. And the question is about multi-select. You can select more than 2 options. And the question is asking you about the nurse determines that a newborn is experiencing hypoglycemia based on which findings? Select all that apply. You can select 2 options or more options as you like. The nurse is trying to determine that the newborn is experiencing the hypoglycemia. What would be the best option that you want to apply? Option A is blood glucose level less than 30 mg per dl. And option B is family history of insulin-dependent diabetes mellitus. Option C is internal fetal monitoring. Option D is irregular respirations, tremors, and hypothermia. Most of you have answered this question. 82 people have answered this question rightly and 62 gone wrong. Okay, let me see the scoreboard. Anu again onto the top. Jisha SMJ is on again the top. Gayatri is again scored the third row and 4th and 5th. Come on. Next, the rationale behind this question is, the option is A, the blood glucose level is less than 30 mg per dl. That is at 1 hour, and irregular respirations and tremors and hypothermia is also associated with the hypoglycemia. So whenever we see within the first 2 hours of life, the glucose levels will be less than 30 mg per dl, and which will be associated with the irregular respirations, tremors, and hypothermia, which are indicative of hypoglycemia. And the blood sugar levels should be considered 45 mg per dl within the 24 hours of baby's birth. So this is the second question. Let us go for the next question. The question is again asking about which area of the foot should the nurse obtain the sample for glucose testing from a term neonate. Option 1, 2, 3 options are there. Option A is lateral aspect of the heel. Option B, middle of the heel. Option C, below the greater toe. Option D is greater toe. It's very easy to answer this question. Even though it's the third round, we still made sure that you will answer this question rightly. And the time is up. We have got 115 answers for this. And most of you have answered correctly. That is 63 people have answered it correctly. Lateral aspect of the heel. Let me show you the scoreboard. Then I will go for the rationale. So Anu on the top. Congratulations, Anu. You are constantly being on the top. Jisha SMJ on the second. Gayatri again scored the third. Jisha and Monami has 4th and 5th. So let me tell you the rationale behind this one. And the correct answer is A, as you said, the lateral aspect of the heel. The most appropriate site for obtaining a blood sample for glucose monitoring in the neonates is using only the lateral aspects, as you can see in this picture, because we wanted to prevent this calcaneus bone to get damaged. That's why only the lateral aspects are always preferred, so that we can, the middle of the foot contains the plantar nerve. So a big no for the middle of the foot also. Only the lateral aspects are mostly preferred for the glucose monitoring in the neonates. So let us go for the next question. Again, you have got the last question in this, and with the double points, make sure you will answer this question also. The first organ affected by hypoglycemia in neonates is what? Which organ do you think with the hypoglycemia the neonates gets affected? First organ, okay? Option A is heart. Option B is lungs. Option C is brain. Option D is kidneys. You have just got 5 seconds to answer this question. Which organ is first affected? Heart, brain, lungs, and kidneys. Which answers would you think? Okay, 53 have rightly answered this question. That is C option is brain. Yep. So let me show you the scoreboard. Oh my God. Yes. Only Kanaka sister, Kanaka from SMJ have scored the top 5 again. Anu is constantly on the same. The correct answer is C, that is brain. The brain is one of the first organs to be affected by hypoglycemia. Shortage of glucose in the brain or neuroglycopenia results in a gradual loss of cognitive function, causing slow reaction time, loss of consciousness, seizures, especially in the newborn. That's why the first affected one is brain. So we have to manage the hypoglycemia effectively. So this is the last question in this. I think mostly we have just come to the end of this quiz. This is the 4th round. So last round in this, make sure that you will score good for this one. And it is about the neonatal resuscitation. Hope you will answer this also the top good. And the question says, what is the first action on commencing resuscitation of a newborn baby? When you're trying to do the resuscitation, what is the first action that you want to take? Option A, follow ABC approach, airway, breathing, and circulation. Option B is dry and cover the baby. Option C is commence chest compressions, and option D is insert a Goodle airway. So which one do you prefer? And the time is up. So we have just got the right answer. Only 12 have answered it, dry and cover the baby. Good for the top 12. So the scoreboard again, yes, Anu is on the top, Jisha and Gayatri, Jisha. These people are again under the top 5 constantly. Congratulations. And the correct answer is B. That is, first thing, you have to dry and cover the baby, because drying action will help stimulate the baby and helps assess whether the resuscitation intervention is required or not. Once you stimulate the baby, automatically if the baby responds, there is no requirement for the resuscitation. That's why we have to, in the neonates, first thing is dry and cover the baby and then stimulate it. So the second question in this one is, in neonatal resuscitation, at what rate should breaths be delivered when providing the positive pressure ventilation? When you are performing the neonatal resuscitation, you need to provide the breaths during which, that is positive pressure ventilation. How much do you provide? Option A, 40 to 60 breaths per minute. Option B, 20 to 40 breaths. Option C, 10 to 20. Option D is 60 to 80 breaths. The time is up. We've got 106 answers in this. 40 to 60 breaths per minute is the right answer. 34 have rightly answered it. Most of you have gone wrong. A scoreboard again, oh my God. Anu have just got down because of one question. Jisha is on the top, Gayatri again on the second top, Jisha again on the third top, and last is team people. Let us see the right answer. That is option A, that is 40 to 60 breaths per minute. If the newborn does not breathe despite stimulation, commence the positive pressure ventilation within the rate of 40 to 60 breaths per minute as per the IAP, that is Indian Academy of Pediatrics, and the NRP guidelines, that is Neonatal Resuscitation Program guidelines. This is the right answer that we need to initiate initially, and we can go beyond that. So this is the last question of this quiz, and you have got double points for this. Please do answer rightly, so you can score the top. Heart rate less than 60 beats per minute after a minute of compressions and adequate ventilation in a newborn. What is the most appropriate next step that you would like to take? Option A, stimulate the newborn. Option B, discontinue the chest compressions. Option C, start dopamine. Option D, administer epinephrine. 1 or 3 have right answered this question. So in this, only 30 people have rightly answered this. That is option D, administer epinephrine. So this is the last final question. As I just wanted to see the scoreboard before that, I will try to tell you the option. Option is B, administer the epinephrine, because a persistent heart rate, which is less than 60 beats per minute, despite the chest compressions and adequate ventilation, is indication for the epinephrine. So it should only be initiated after establishing the adequate ventilation to avoid the myocardial injury, as it increases the O2 consumption, also the workload. So this is the right answer. Next, I think everybody are excited to know who won the game. So before that, I have a small announcement for this. Congratulations to whomsoever have got on the top 5. Before that, I just wanted to give you a small suggestion about our webinars. Join us every Thursday Facebook Live at 3 p.m. and for more and more exciting webinars and quizzes that we are getting every Thursday for you people. So take a selfie in case if you liked our webinars or quiz with your team whom you have participated, or with your group. And please make sure that you will use this hashtag Yashoda Hospitals, if you want to add up nursing education and training webinar series, which is there on the social media. Post it on the social media and keep it more interesting. That's for today. So let me show you who is on the top score. Shall we move on? Yes. So here is on the top 3 first, and then I'll try to tell you. Top 3 is team people. Top 2 is Gayatri. And top 1 is, come on, guess. Jisha is on the top first. Congratulations, Jisha, Gayatri, and team people. And runner-ups are Jisha, SMJ, and Divya. These are the top 5. Congratulations everyone for joining this Nursing Pro quiz, Neonatal Nursing for today. That's for today. We will definitely join you next Thursday with a more interesting webinars. Please join us on Facebook Live at 3 p.m. every Thursday. Stay tuned. Over to you, Amar sir.
Okay. Thank you, Pratyusha. You've taken us a very simple and better way for today's quiz. And well played, everyone. Congratulations for the winners. Please, as Pratyusha has said, log into our Facebook page and we'll get exciting things on to the every week Thursday 3 p.m. Thank you. Thank you, Pratyusha.